We will now discuss the physical principles on which ultrasonic examinations are based.
The leading question when we prepared this chapter was, how much physics does a doctor have to know who wants to perform ultrasound examinations?
I think only physical parameters that influence our image on the screen are relevant for us.
For example, what are the most important settings on the machine? How can we obtain best images? And are there any safety requirements?
Ultrasound in a medical diagnostic setting is a mechanical wave based on a rather high frequency. We use frequencies from 1 MHz up to 15 MHz. The ultrasonic wave is a mechanical longitudinal wave. We have areas of increased pressure and areas of decreased pressure, and these changing of pressure travels through the tissue.
So we need a medium, a tissue through which the ultrasound beam can pass.
The principle of imaging using ultrasound is the same as that of a sonar of a ship. We use this principle by emitting sound waves. This will be reflected by an obstacle and perceived on our machines.
The very same principle works in the transducer of our ultrasound machine. A sound wave is emitted, the sound is reflected by a structure and is picked up by the transducer again.
In this figure, we see the physical principle. A sound wave is generated, gets reflected by a structure in the patient's body, and returns to the probe. The time in between sending and receiving the signal is measured.
We know at what speed the sound penetrates the tissue, and so the machine is able to calculate how deep the sound wave has penetrated. A bright pixel appears on the screen. The stronger the signal, the brighter the pixel.
The most important parameters of an ultrasound wave are the following. The period is the time of one cycle. The distance the wave travels in one cycle is one wavelength. Frequency tells us how many cycles are performed in 1 second.
Later on, we will also have to mention the energy of ultrasonic waves. Frequency is one of our most relevant settings for sonographic imaging. Let's go in for some important details.
It is essential that the sound will penetrate the whole organ, because also deep structures, for instance in the liver, must be reached. Sound waves of a long wavelength, that is, for a lower frequency, penetrate deeper into the body. These sound waves are used to examine structures far from the transducer.
In abdominal ultrasound examinations, we normally use a curved array transducer with a frequency between 2 and 6 MHz. For special examinations in the near field, we also sometimes use a 5 to 40 MHz linear array transducer, like this one over here.
We want to achieve as good as a resolution as possible. The shorter the wavelengths of the sound waves are, the better the resolution, which means that high frequencies lead to a better resolution. But because the acoustic power of the high-frequency sound waves are more attenuated, they will not reach the very far regions and therefore do not depict deep structures. We have to decide what we are going to examine. When we use high frequency, we will get high resolution, but only in the superficial areas under the skin.
But when we want to depict structures in the far field, we have to use low-frequency waves, but they will have less resolution on the screen. We show you the features of different frequencies on this screen.
There are two quite small structures located in the near field over here, and one in the far field. Using a low-frequency setting, the machine cannot distinguish the lesions and show only one great echo in the near field, but we will be able to detect the deeper lesion because we used a lower frequency with good penetration.
On the other side, choosing a high-frequency probe, we will find two defined structures in the near field. The dorsal located structure is not reached by the waves. For this reason, we use both a high-frequency transducer for superficial structures, and for deep structures, we use a low-frequency transducer.
Before performing an ultrasound examination, the following settings have to be selected: depth, frequency, focus,
gain, and TGC, so-called time gain compensation.
It is essential that we take enough time for these presettings. For every patient and for every machine, adjustments have to be made. With some practice, an image can often be significantly improved. It is like playing a musical instrument. The best of pianos will not produce a lovely sound if the keys are not used properly. On the other hand, it can be quite surprising what lovely music can be produced by a good musician on a not so perfect instrument.
With sonography, the situation is very similar. If you take time to find the perfect settings, you will achieve surprising results even with an old machine.
First, we adjust the depth. With depth, you determine the distance from which the machine is to record and to depict signals. We will select a setting which allows the organ to be depicted on the screen as large as possible. The immediate surroundings should also be visible. Here we can see the depth is not correctly set. The liver is only shown here in the upper field of the screen. There are no echoes seen over here.
So we're going to adjust the depth. Let's see what happens now. Okay, so now we've reduced the settings too much. Only 7 centimeters of the liver are displayed, so we have to go deeper with a sound beam again.
So we go on, adjusting the depth, and finally we found the best setting. The whole organ and the adjacent structures like the diaphragm are seen here very lovely.
Next, we select the correct focus. The focus determines at what depth the sound waves are to be focused, at what distance we see our region of interest.
Sometimes the manufacturers will recommend settings. I prefer to set the focus on the deepest point of an image, or at least at 60 to 80% of the maximum of the depth. When we take a close look on the far field over here, we see a quite bad image quality when the focus is set too superficially.
Let's go for the next video. So here we can see that the quality of our examination improves when the focus is more in the far region over here. Please point to the region again where the focus lies. Here, finally here. And also the farer regions are displayed properly now.
Next, we select the highest possible frequency, which allows us to depict the deepest structure well. This provides the best resolution for the depth required. Always remember, the higher the frequency, the better the resolution. In this particular case, we used 1.8 megahertz, and we see less resolution, but also less attenuation in the far field. And when we zoom in, there are only less details, so the resolution is quite bad. We increase to 4.0 megahertz.
So we got a higher frequency and, of course, a better resolution. We see more details.
When we increase the frequency even higher to 5 megahertz, the resolution improves and there are more details seen over here.
Even increasing the frequency to 6 megahertz, we again got better resolution, but more attenuation. So we get no echoes from the far field.
So we have to turn back to 5 megahertz. That's the best adjustment. We have the highest frequency possible. We have the most details seen on the screen, and there are enough details from the far field seen over here. The pleural effusion over here and the diaphragm over here.